Hello everybody, this is Dr. Gita Mathai and this is my Health Vibes channel. Today we are going to talk about the shoulder joint. Everybody has got two shoulder joints. This is a ball and socket joint held together by muscles and ligaments. A ball and socket joint means that it can move in all four directions, up, down, sideways, backwards, everywhere. So when something goes wrong with the joint, people are unable to comb their hair, they are unable to put on their clothes, and the pain makes them very unhappy. Now, if you look at the statistics, 30% of the people between the ages of 30 and 70 have joint pain. They have it in one shoulder joint or both shoulder joints. Sometimes they remember that they had an accident or they fell down or they did something to precipitate the shoulder pain, or the ball and socket joint, it was pulled out by somebody else with vigorous force. Most of the time people cannot remember anything happening to the joint to cause it to suddenly pain like that. But what happens is that in India, even though there is plentiful sunlight, nobody goes out into the sun, and 30% of the people are deficient in vitamin D3. This is the vitamin responsible for making your bones strong. The weakest bones in the body are the neck bones. So when the bones become weak, the neck bones get squashed one on top of the other, and the nerves which go to the shoulder get affected and pinched, and the shoulder starts to pain. The head weighs 8 kilos, and this 8 kilo head has to sit on these neck bones. People do not sit properly, their posture is very bad, and now especially with the IT industry and laptops, people tend not to sit at a table and a desk, but to lie on a sofa, lie on the bed and start using their laptops. The head is held at a very awkward angle, so the bones in the already weak neck muscles move out of place and pinch the nerves. The other people who really suffer are those with diabetes. 30% of the diabetic patients get pain in one or both shoulders at some time or the other. This is because their diabetes is not controlled, and the glycogenation, that is the sugar, gets deposited in the shoulder joint and makes it sticky and makes it difficult to move the shoulder joint. Without any of these problems, if you keep using your arms, like if you're a painter, or even if you just wash clothes or play sports like badminton or tennis, you can develop shoulder pain. Sometimes the shoulder pain is in both the shoulders, and it is part of a generalized arthritis like osteoarthritis or rheumatoid arthritis. But in these cases, both the shoulder joints are affected, and the shoulder joint is warm and tender if pressed. If you go to a doctor with shoulder pain, he may do blood tests to test you for diabetes, vitamin D3 levels. He'll do an X-ray, MRI scans to see where exactly and what exactly the problem is. But shoulder pain may not be because of anything in the shoulder at all. If you have a heart attack, for example, the same nerves supply the heart and go to the shoulder. So you can suddenly develop left-sided shoulder pain or pain radiating to the back or the jaw. The other thing is that the chest is separated from the abdomen by a muscle called the diaphragm, which also gets the same nerve supply as the shoulder. So if the liver has a problem, or the gallbladder, or there is some problem in the abdomen, you can also develop a shoulder pain. It can also occur with lung infections. So if the shoulder pain does not disappear within 5 or 6 days with rest, icing, and some anti-inflammatory or painkillers, please go to a doctor and have the shoulder completely evaluated to see where the pain is coming from and what it is. This is Dr. Gita Mathai signing off. This is my Health Vibes channel. If you liked what you heard, please subscribe to my channel and press the bell button. The same content is available in Tamil. Thank you.